welcome back. Well, today I am joined by three people. We've got Susan McInerney, who is here on behalf of Social Services. We have Jennifer Brya, who is here on behalf of Be Well Orange County. And then we have Nancy Cooper, who is the chair of the American Foundation for Suicide Prevention here in Orange County. Well, thank you, ladies, for joining me today.
Thank you.
Nice to be here.
Now, Susan, you have brought on these lovely ladies that are here, obviously, for a very, very important cause and situation that we are facing, probably more than ever before, primarily amongst our elderly. And I'm assuming most of it is probably because of COVID-19. And you and I have talked many times about this, but tell me a little bit about sort of why you all got together.
Yes, well, thank you for having us all on. We are all together because we are having a conference coming up in October for Suicide Prevention Initiative program. I'm very excited to work with the whole entire group. I'm one part of it. It's a 2-day conference, and it has a long history before we got involved in social services. So I'll turn it over to Jennifer to give a little background. But for Laguna Woods Village Social Services, we're really happy to be a part of the conference that's coming up in October. Jennifer, can you give us a little background for everyone about the program?
Sure. And just as a reminder, I'm with Be Well Orange County, and I am the director of the Community Suicide Prevention Initiative. And this initiative really at its core is a coalition of partners, organizations, and community members who are really committed to reducing suicides in Orange County. It grew out of a grassroots movement about 4 or 5 years ago when different community members who had been touched by suicide started meeting on Saturday mornings once a month at different Panera Bread locations around the county. And they met over coffee and a common experience and really a commitment to improving suicide rates in the county. So they asked the county leadership to kind of help with some data around what we were seeing in the trends. And what we saw is that over a 10-year period from 2008 to 2018, the suicide rate in Orange County increased by 25%. And that's true across genders and age groups and ethnicities. But we do have 3 target groups in our community who are at particularly high risk. That's teenagers and young adults, men in their middle years, and older adults, particularly those living in isolation. So we have a coalition of partners, public, private, faith-based organizations, healthcare partners, CBOs, NAMI, Council on Aging, that are all in this to try to address this trend and move it in a different direction. And that's why we are having this conference coming up.
So Nancy, based on what Jennifer had just spoken about, I'm assuming you're experiencing the same kinds of things.
Yes, we are. We are experiencing the same kinds of things of people just expressing their stress, expressing their concern about what's happening in this atmosphere that we have today.
Okay. All right. Now, I'm going to go back to Jennifer for just a second. The Be Well Orange County, I've spoken to many people regarding that organization and your actual location. So is suicide prevention dedicated? Is it dedicated to one level, or do you have just a few rooms, or how does that work there?
Well, I think you're referring to the Be Well campus, which is a facility in Orange New that just opened earlier this year, and it does have services for folks in psychiatric crisis, as well as those who are battling substance use disorders. But the Community Suicide Prevention Initiative is another activity under the Be Well umbrella. So while we do have the campus and there are clinical services available there, this is really a community-driven initiative to really promote awareness about suicide and mental health, and also to reduce the stigma that is so present in our communities that really prevents people who are in crisis or in need from seeking help. So we're working across all of our other partners, businesses, faith-based communities, educational partners, to really bring about awareness around what's happening in Orange County. What can we do about it? What are the resources that are available? How do you take care of yourself and your neighbors and your friends and family? And that's really the purpose behind this conference, is to share resources and knowledge so that people know where to find help if and when they or someone that they love needs it.
Okay, great. And Susan, can you just sort of walk us through the details of the event? It's October 14th through the 15th, and that was from 9 to 12.
It is, and on the second day, it's going to be focused on older adults. So I'm hoping that, I mean, of course, we want Laguna Woods residents to attend both days, but if you only have one day, it seems that the older adults would make more sense to attend. We're going to have Dr. Park is going to be a part of it from Council on Aging, Mark Odom from Alzheimer's Orange County, and myself. What I like about that is, as you probably know, Lisa, those are all of our partners of people who work within Laguna Woods Social Services. So we have a very close working relationship, and as this speaks to that, we work together on initiatives like this. There's going to be, I think it's important to attend and important to speak about, because you have to remember what Jennifer said. You know, older adults 85 and older are the highest risk, which I think a lot of people don't realize that sometimes. So it's important to get the word out, talk about it, talk about resources, talk about things that we can do for prevention. But also, I think one of the things that Mark Odom from Alzheimer's will be talking about is people with dementia or memory impairment, and how that impacts not only the resident with dementia, but the caregivers. We spend a lot of time providing resources and referrals and support to caregivers within the village. So Mark is going to be talking about that. But I'm proud to be on this panel because it's a lot of great knowledge, information, and it will be a good opportunity for village residents to learn more.
That is great. And I thank you all for the information and for being such a great, a part of such a great opportunity that's happening for everyone. So thank you.
Thank you, Lisa.
Thank you.
And we'll be right back after this.